two things that, I'm a huge believer in, or we are, and at least in our work, is one, mental health care is healthcare.
Yeah.
You can't really differentiate it, and they need to be treated that way. The other is, it's happening so young, and I know you see this in your work with the Children's Hospital, but it's affecting so many children even at a young age. So one of the other things is screening people and doing a better job of screening people, knowing that a lot of this falls on primary care, falls on ER docs, falls on people that are not trained psychiatrists or psychologists. So, how do you look at screening, or have you seen that be implemented correctly or incorrectly, or not at all in some cases?
Yeah, and I just want to just tag back to what you just said. I do think it affects physical health, and that's the thing, right? Mental health and stress absolutely has effects on physical health, and we know that from ACEs as well, right? Like all the research that's been done on toxic stress. So I think that we need to try and find methods, and maybe using technology, to make it somewhat of a simpler task to diagnose people, right? And then a simpler task to connect people with treatment. And so, part of that is using digital technology. Is it on the EMR that we have a simple screen like your organization does? Or is it like an app that the patient kind of brings in with them? But doctors and nurses and mid-levels are overloaded right now. So we have to acknowledge that, but we still have to acknowledge how to get the mental health care to the patients that need it. And so digital is an awesome way to try and close that gap.